We begin tonight in Rockford, where the federally mandated annual Count to Address Homelessness kicked off this afternoon. For the next 24 hours, city staff will be gathering information on how many people in our community live without a permanent roof over their heads. 13 WREX's Emily McMinn spoke with organizers today, joining us now in studio with more. And Emily, tell us a little more about this count.
Well, Derek, it will be taking place in both Boone and DeKalb counties as well as they look to gather information beyond just the number of people, including age and certain health factors. This all comes as they work to implement the data and make housing more accessible. The annual Count to Address Homelessness has been happening around the country for decades, allowing cities like Rockford to learn more about the community's housing needs.
When we do encounter people, we let them know who we are, what we're doing, and why we're doing it, that it does help us get funding for our community to provide assistance. And then we ask them if it's okay to ask them a few questions and do a quick survey with them.
For just about the next 24 hours, organizers from the Northern Illinois Homeless Coalition, Rockford Police and Fire Departments, and other organizations will move throughout the city to gather the data.
We take places that we know that homeless people sometimes are. So those are kind of our starting locations. So we put all of those on the list, and then our teams will go out to all those places. But we also have an outreach list where people actually report locations to us as well, like I'm sleeping in this parking lot in my car.
In 2023, the city found 445 homeless community members. Last year, that number rose to 486.
It was an increase from the year before, but I think if you look at homeless data throughout the entire country, that's what we're seeing everywhere.
The problem persists outside the state line, as officials know times are challenging.
The increased rent costs, lack of available housing for people, all of those things are really playing a big factor in getting people housed.
With the data, they will implement new programs and request grant funding, all aimed towards addressing any issues that they discover.
One year we found out that a lot of people reported that they had mental health disabilities. So just using that as an example, if we know that we have a higher population of mental health diagnoses, the next year when we implement housing plans, we might look at programs that do more to provide wraparound services for mental health.
The annual Count to Address Homelessness will go through 3 o'clock tomorrow. Back over to you, Derek.
All right, thanks a lot for that, Emily.